Beyond the Paper Gown inspires, informs, and empowers women with the latest information about their health and healthcare choices.
Hi, I'm Dr. Mitzi Krockover. I'm an internist and women's health advocate. I created Beyond the Paper Gown because women are more than half the population, but our health needs have not been met by our healthcare system. So many factors impact on our health. Family history, where we live, what our socioeconomic status is, if we have access to transportation or grocery stores, or even if we feel safe in our own neighborhoods. Racism and gender bias are also important factors that impact on our health. Women often don't feel heard when they go to the doctor. And it's not all the doctor's fault. There are larger factors that are not so obvious, like the historic lack of research on women's health, as well as legislation, policy, and politics. For example, it wasn't until 1994 that the NIH mandated that women and other underrepresented groups be included in research studies in order to be funded. And there has been relatively little research that has been done on women's issues such as fibromyalgia, mental health, endometriosis, and fibroids. Doctors base their treatment on science, so if the science isn't there, they don't have the answers they need to diagnose and treat. And we don't have to look far to see the impact of policies, such as the limits of access to abortion, but also the mandate of the Affordable Care Act providing access to preventive services and prohibiting insurance companies from charging women more for their health care insurance. I feel strongly that if women knew about these issues, they are better able to get the health care they need, ask the right questions, and take action such as voting and advocating to better their health. So we look beyond the healthcare system, beyond the paper gown, which symbolizes that system, to get those answers from scientists, clinicians, policymakers, and innovators. So what's my experience? Well, more than 20 years ago, I had the honor and opportunity to help create the Iris Cantor UCLA Women's Health Center with some remarkable colleagues and served as the founding medical director. The center was named a Center of Excellence in Women's Health by the Department of Health and Human Services. I then joined Humana as Vice President of Women's Health because I knew that payers and employers impact on access to health care in the United States, and they also provide important health programs. And last but not least, I'm a woman and the mother of 2 daughters. I've had a lot of experience, and I've had a lot of experiences. So I've either navigated or I'm navigating many of the issues you are. So is there any good news? Well, a few years ago, I was consulted by some companies in the women's health space for my clinical expertise, and it hit me that this was the next way we were going to make the needed changes in women's health. Women are literally taking their frustration and their pain points and finding their own solutions and making companies out of them. It's a growing area called femtech, and it's really moving the needle in conducting more research, gathering more data, and most of all, improving the health of women. I believe in the promise of these innovations and innovators so much, I became an investor and now mentor some of these incredible entrepreneurs. What's also making me excited is the growing number of women in science and clinical practice who are bringing their perspectives and experience to the bench and to the bedside. Female politicians and other policymakers are also making a difference. And it's not to say it's just women. I'd be remiss if I didn't recognize the men who are also passionate about women's health issues because they know that when women are taken care of, everyone's better off. That's who we're going to be talking to throughout these podcasts, scientists, clinicians, innovators, and policymakers, so you can better understand the forces at play when it comes to your health. We want to give women news they can use in their everyday life, so we'll also be providing action steps and takeaways and building community together along the way. I do hope you'll join us.
This episode of Beyond the Paper Gown was produced by Dr. Mitzi Krockover.